Our guest today, Dr. Stacey Kargman from the Maryland Natural Health Center in Owings Mills, Maryland, so local to here. Dr. Kargman is a board-certified Doctor of Naturopathic Medicine and Diplomate of Acupuncture. After graduating from Hampshire College with a BA in Psychology and Women's Studies, she received her Doctor of Naturopathic Medicine and a Master's in TCM, that's Traditional Chinese Medicine, acupuncture degrees from Southwest College of Naturopathic Medicine in Tempe, Arizona in 1996 and 97, respectively. Dr. Kargman then left her practice in Tucson, Arizona in 2000 to begin her practice here in Baltimore. And in April 2001, she took over the Maryland Natural Health Center in Owings Mills, Maryland, and began working in Acupuncture Associates of Annapolis. Aside from her private practice in Tucson, Dr. Kargman worked with the Southern Arizona AIDS Foundation as their complementary medicine physician, working with patients and their primary care physicians in helping patients improve their health and quality of life while being HIV positive. She also worked with the Tucson Rape Crisis Center as a forensic examiner, providing exams and support for people after they had been raped or sexually assaulted. In her current practice, Dr. Kargman treats a wide variety of clients of all ages for both acute and chronic conditions. Her primary modalities include acupuncture, herbal medicine, nutritional and lifestyle counseling, homeopathy, and craniosacral therapy, something Mrs. Mousak actually tried. Her specialties include women's health, hormonal balancing, gastrointestinal disorders, allergy testing and elimination, endocrine imbalances, mood disorders including chronic anxiety, depression, panic attacks, addictions, and management of chronic migraine headaches. That's a lot, Dr. Kargman. So currently, Dr. Kargman sees patients at multiple places in Maryland as well as virtual. So, Dr. Kargman, very big welcome to you, joining us on Understanding CBD. So happy to have you join us today.
Oh, thank you, guys. It's great to be here.
Nice. Yeah, thank you for being here and welcome to the show, Dr. Kargman. I got a question for you, the first one at least. Coming from Arizona, moving to Baltimore, how do you compare the two states, really?
Oh, goodness. I mean, it's kind of night and day, actually. My practice, one major thing in Arizona, when I first moved to Maryland, naturopathic doctors weren't licensed. So I primarily was practicing under my acupuncture license, whereas in Arizona, we're licensed physicians, and I could do pretty much everything, MDs and DOs could do, except for prescribing certain medications. I had prescription rights. I could do a lot more, but that was okay.
When did things open up in Maryland?
We became licensed naturopathic doctors. Oh goodness, it's been about maybe 5 years. I forget the exact date. But,
okay. All right, good.
Well, and that's a long time to get to that place.
Yes, I know, and rightfully so, especially the fact that the medicine that you practice has been around for around 2,500 years.
Oh, roughly.
Yeah. So anyway, I'd like you to first at least help us with this because it's confusing to a lot of people that they don't necessarily know what naturopathic medicine is or naturopathic doctors. So how are naturopathic doctors different from a traditional medical doctor?
Yeah, so when you think about different kind of doctors, physicians, you have MDs, you have DOs, you have naturopathic doctors, you have chiropractors, and we all go to our own separate medical schools, and we're all trained in the same basics. So we all have the same foundation of understanding how the body works and how things break down in the disease process. Where we all differ is when we start focusing on treatment and how we go about treatment. And that's where we all kind of go in our separate directions. I mean, we all have a similar idea about treatment, but, excuse me, we use different modalities oftentimes to treat people. So that's kind of how we differ.
And naturopath is obviously going more natural based.
Yeah, exactly. And, and our big focus is looking at the whole body as a system rather than individual parts, and figuring out the underlying conditions and then focusing on the underlying conditions and helping to allow the body to essentially heal itself. And so we typically don't use prescription medications. We use more natural ways of dealing with things. And not only do we use, herbs and homeopathy, sort of things that you take orally, but we also really look at diet, lifestyle in terms of, work, life, stress, family, exercise, all the things you're putting into your body or being exposed to, all of that affects health. So it's a very comprehensive approach to looking at what's going wrong and then how to help somebody or work with somebody to fix it.
Naturally, being the pivotal word. And, so gut health is such a prevalent topic right now. There's so much about it. People are reading about it. They're curious about it. What made you choose gut health as the topic that we'll be discussing today?
Well, so GI disorders affect sort of more people in the United States than, a combination of heart disease, AIDS, and cancer combined. And about, I'd say, 74% of Americans deal with some kind of GI-related symptom typically for, more than a 6-month period. And it's one of the most common reasons people look for medical assistance or over-the-counter assistance. Aside from the common cold, GI discomfort is probably the most common reason people look for medical advice. So it's very prevalent. The other reason is it's so fixable, and I like having happy patients that I can help. And GI issues is pretty easy to fix. So I like that.
Yeah, well, it sounds like a good opportunity then to go after, because you're winning a lot. And it's something that I know personally I've dealt with, and a natural approach really a lot of times is the only thing that can happen. But to take us a step back, because I know I had to go through and still learning a lot about the digestive system and the process. Can you define for us what is the gut and this digestive process that we're going to talk about today?
Yeah. I mean, so the gut is everything encompasses all the organs that basically, if you think about eating, I'll use that as an example. You put the food in your mouth and it travels all the way through your body and then comes out the other end. And every part that food interacts with is the GI tract, if that makes sense. And the thing to think about is that it's actually this like closed system. So if you think about it, it's almost like this tunnel that runs through your body. The food doesn't directly, start just flowing into your, bloodstream or anything. It really goes through this tunnel, and then there's all these chemical reactions that occur through the tunnel that allow it to be broken down and absorbed and utilized or, converted into vitamins and minerals and all that stuff. And so there's, multiple steps that occur through that process that allow your body to utilize the food. And so there's multiple places along that system that can also that can break down. And so it's important that all those systems work in order to, have a healthy body.
And then what about the gut microbiome specifically? Right.
So the gut microbiome is basically inside your gut, mainly in your large intestine. There are trillions of organisms that live in there, which is kind of crazy to imagine. But basically, there's a bunch of good bacteria that lives in your gut. And what it does basically is help your body to break down the food that you're eating, and also helps you to convert different substances into vitamins, and so your body can utilize them. So they're helping you, you're helping them. It's sort of like a nice,
happy family.
Yeah, that's crazy to think that they're inside of you, but it's actually outside of you, but it's inside of you. Right. And anyway, we need to take a break, Dr. Kargman. We're talking with Dr. Kargman, a naturopathic physician and acupuncturist. We're bringing awareness to digestion, so stay tuned. We're also going to talk about how CBD plays a role here. Curious to start off with, as far as CBD plays a role, how have you seen it play an active role in the digestive process?
Well, so when dealing with the digestive system, a couple of things that are going on. One is oftentimes you have some chronic inflammation. And so CBD is one of the things I like to use, or, in conjunction with, to help with the inflammatory issue that's going on in the gut, and in the entire body. The other piece is there's, definitely a connection, like a gut-brain connection. And in terms of mood, anxiety, stress, CBD is great to help with that. And that is often tied in with GI issues. So, and it kind of goes both ways, and if you think about it, people often describe it when they're having digestive issues, that they have a, like a sensitive stomach, or, like when they get emotional or they're stressed, their GI issues oftentimes flare. And so by using CBD, that often can help sort of calm those triggers down. The other thing is, in terms of digestive issues too, for certain conditions, sometimes when people have IBS, sometimes when people have Crohn's or colitis, they tend to have gut pain. And so the CBD is really helpful also in helping to manage the pain that goes along with that while we're working on healing the digestive tract. So there's a lot of different parts of it that the CBD works really well. And then also sort of the way I focus on treatment, there's sort of like this 5R approach. I try to remove the issue that's triggering things, replace it if there's any kind of sort of digestive chemistry imbalances, reinoculate, which is, focusing on making sure all that good bacteria is there, and then regenerate, healing the gut lining, and then retaining what we've done. So the CBD really comes in, especially on 3 different parts: removing the issue. So again, if it's tied in with stress or inflammation, the CBD helps with that. When we're regenerating and healing the gut, the CBD, again, great for the inflammatory process. And then in terms of retaining what we're doing, it helps with the stress reduction, helps with the pain, the inflammation, all of that. So it's an integral part of the whole process.
So I'm really intrigued by the connection that you said between the mood and the gut. That's interesting to me. And I think a lot of people are curious about that. Is it the mood that controls the gut, or is it the gut that controls the mood, like a chicken or an egg thing?
Right. And I think it's actually both. Definitely, again, mood, when you're feeling under stress, when you're nervous, when you're anxious, people, especially if they have a sensitive stomach, that's the times when it really acts up. Subsequently, when you have digestive problems, you can have all kind of symptoms. And some of the symptoms that I chronically see are mood issues. I definitely, when you have GI issues, there's, it aggravates your depression, it aggravates mood swings, it aggravates foggy thinking, which is kind of ties in with that. It aggravates sort of motivation. So, basically the chicken and the egg all at the same time.
Yeah, so then the removing part of the equation, which is the first step, and I guess you're diagnosing where that problem is. How do you diagnose these types of problems? Because it is, I guess it would start with, are you chewing your food? And then
Right.
It could be something further down the road.
Mm-hmm. Yeah, and oftentimes there's, when I look at, what's going on with people, I kind of think of it as a bicycle wheel with lots of spokes. So it's usually not just one spoke is bent or weak. There's multiple spokes that are problematic. And so we want to strengthen as many of them as possible. And by strengthening as many of them as possible, then we can eliminate the symptoms. So we're looking, so it's usually not just one thing. But, the common things that I see in terms of the digestive issues is either, again, looking to see if there's a chemistry imbalance, that you're not making the right enzymes, your body's not producing enough hydrochloric acid, like your stomach's not making enough hydrochloric acid, or if there's things like food allergies is a pretty common thing that causes irritation to the digestive tract. And, so I'll do things like food allergy testing. or doing other testing to look to make sure that there's no problematic bacteria living in the gut or parasites that are living in the gut, looking for things that, that aren't supposed to be living in there. Or, a significant imbalance in things like yeast and bacteria, because both live in there and you want them to be in a happy ratio. But when the ratio gets thrown off, that's problematic.
So what about
doing a little testing, a little exploring, and looking at symptoms and looking at people's lifestyle too? Just sitting and listening to people. Oftentimes they tell me what the problem is if you just listen to them for a few minutes.
So the people that have the chronic pain and the joint pain, how does their gut relate to that? I can understand the mood, but how does it also relate to the chronic pain?
Well, the gut, when the integrity of the gut is compromised, that will lead to chronic inflammation. And the chronic inflammation is the cause of the pain. So, when I say the integrity of the gut is compromised, what happens is, especially in your large intestine, you have, layers of membrane that surround it as a significant barrier to keep things just from floating into your bloodstream, because that's not what you want to do. You want to be really selective about that. But what happens is you get something called leaky gut, where you get almost like these little micro tears in the mucous membrane in your large intestine, and food particles and other things start to seep out into your bloodstream. And when that happens, your body reacts, and one of the things that it does is cause inflammation in your body. So that is usually the cause of a lot of the pain, either in your gut or in your head or in your elbow or, all over your body.
Gotcha.
So,
when you do a lookup for leaky gut, like the FDA, there isn't any FDA-approved treatments currently available specifically for leaky gut. And I also noticed that the NHS talks about it as leaky gut syndrome. They talk it in a way like it's a proposed condition or it's theoretical. Right. Can you shed some light on the other perspectives on this?
Honestly, I can't. Sometimes I have to wonder sort of like, what some other professionals are doing or thinking or seeing. It's kind of a no-brainer to me. So I can't really understand why that isn't just as obvious as it is to me as it is to other people, other professionals.
So the solution to plug the leak, they don't have a direct solution for. So maybe why they don't, just they don't have a solution for it. But the solution to really plug this up or to plug the leak, is it? You're saying this is an easy thing to do.
Right, and it's not even plugging the leak. I mean, if you think about it, like if you get a sore, you cut your hand, or you cut your, external skin, you got it. It takes a little while, and that's got to heal, and eventually your body heals it up, and your skin's fine, and you never know that you had a hole in your arm. It's the same kind of thing inside your gut. The problem is, for instance, if you have a food allergy or food sensitivity, and you're eating something that's chronically irritating that mucous membrane, then your body's never going to really get a chance to heal it, or it has a harder time to heal it. And then you add life stress, and then you add just a lousy diet on top of it, or some prescription medications. I mean, there's plenty of prescription medications that irritate the lining of your gut as well, like aspirin or things like that can cause ulcers. I mean, doctors know about that. So it's also ulcers is something that traditional doctors or GI doctors deal with all the time, and so an ulcer is kind of a leaky, is the equivalent to leaky gut in the stomach.
Yeah.
This just happens in your large intestine. And so, all these things can aggravate that. And so what I do is, again, try to find out what's causing that irritation, get rid of it, and then give you things like certain herbs, like very mucilaginous herbs, something called L-glutamine. All of those are good to help repair that lining. So it's not so much plugging it, because a plug can pop out. You really want to heal that.
Right. Now, do people come to you often, and I brought up the FDA not having a solution as a problem. Do people come to you expecting for you to give them a pill to solve this?
Some do, and what I do with a lot of patients is I have an option where you can, we can do a 10-minute phone call before you actually set up an appointment, and it's free. And just very briefly talk about, what's going on. And I can, number one, see if I can help you or not. If I can, I'm happy to send you to who can help you. But I like to let people know, like, I'm not going to just give you a, one little pill and that's going to, heal everything. It's, it's some work to work with me, and I'm going to look at what you're eating and what you're drinking and how your stress is, and, and give you, multiple ways in which we can improve your health.
That's important. They say that, I'm going to get a little gross here. They say that you can tell a lot about a person by their stool or fecal sample. I mean, it's just known. Sure. And the question is, for the people listening and for anybody that actually wants to see for themselves, is there a self-assessment tool? Is there something that people should be looking for? We can get graphic and gross here if we want.
Oh, sure. Well, one thing is you should be having a pooping or having a bowel movement every day. First of all, so, when people come in and tell me that they, have maybe once or twice a week, that's already a little red flag that, and theoretically you should be having a bowel movement pretty much after every meal. So if you're eating 3 times a day, you should theoretically have one 3 times a day. Now that is not as common, realistically as theoretically, but, that's sort of how your body should be working. So if you're not having a bowel movement every day, that's one sign that maybe, things are a little slower. And then just sort of, if you want to actually look at it, look at what it looks like. Yep. Is it, is the color a little funky? Do you see half your meal still in there?
What does a perfect stool look like? What's the goal,
Yeah, I mean, you want it to you don't want it to, you don't want you don't want to have to be sitting there for an hour for it to come out. It should be sort of, a moderate size, a color, a nice brown color, pretty well formed.
Yeah, is the I've seen that product. You probably have. It's called the Squatty Potty. Have you heard of that, Max?
I have heard.
It's like a stool you put next to your toilet to raise your feet up higher,
so you're in an appropriate position.
Yeah, I think it says it lines you up better. Is that?
Mm-hmm.
So, that's real.
I mean, something like that, is ideal for the right sort of ergonomic setup for having a bowel movement.
Well, in Asia, they do squat.
There's a samurai position that they say.
Yeah. Right,
also.
Exactly. Yeah. Exactly. So, that makes it a little easier to come out.
So the moral of the story is if it sings and dances at you, it's probably an issue.
Right, exactly.
Right.
Or if it only sings and dances only once a week, that's an issue.
A college student asks, do you have any tips for settling a nervous stomach? Whenever it's test day, my stomach gets upset and I get diarrhea. Any suggestions?
Well, so, a couple of things. Using things like CBD is great because it's going to help with the nervousness. And if we can get the nervousness down, then subsequently the loose stools and stuff should not even occur. And just, doing things like meditation and breathing, any kind of relaxation techniques are good. And then herbally, things like peppermint, ginger, chamomile are all really good herbs to just help sort of calm you down and settle your stomach. So making some tea with those is great.
That's good. So you're given a little a pre and a post, so in advance, you can adjust both that mind to gut and then gut to mind so that you got both
exactly.
there. CBD before helps. Good advice.
Let's stay on that gut to mind thing. I have a personal question instead of a listener question. So why is it that when you get closer to your destination, you feel more urgency? What is going on there?
Closer Closer to, you mean like closer to the bathroom?
Yeah, like, when I'm trying to, be conscious when you're getting closer to home and so the urgency picks up, it's almost as if your gut knows that you're physically closer.
Exactly. Your body does know. And so it starts sort of relaxing a little bit. And what kind of holds, if you want to get graphic, what's holding your poop in is muscles. And as you're getting home and you're starting to feel more comfortable, your body's relaxing and your muscles are starting to relax. So it gets a little more urgent because the muscles, down there are starting to, relax a little bit. So.
I'm glad you asked that because I notice that too. Sometimes I get close, if I'm on the road and I see, I'm okay to hold it, but I see the next exit with, they have a gas station and a bathroom, I instantly have to go 10 times more.
It's the final countdown. You know what I mean? You start feeling that pressure. Yeah.
All right, good. We got one more question. Yeah. We got another question here. Besides the fact that insurance doesn't cover plant medicine supplements, how are plant supplements different from pills at the pharmacy?
Well, they're usually, pills from the pharmacy are often made like in a lab and chemically, so they're not necessarily even derived from plants at all. Plant medications are essentially the plant. So if you're taking herbs, like say an herbal tincture, which is like a liquid herb, what they're doing is just taking the whole plant, putting it usually like in an alcohol or something, and what that does is basically extract all the chemicals from the plant into the alcohol, and so you're taking the plant directly. Or again, if you're making tea, same thing. You take the herbs, which is the whole plant dried, put it in water and extract the important parts of it through the water, and you're drinking it down. So you're getting the plant directly as opposed to some synthetic thing that's made in a lab. And it may be from a plant or it may be from who knows what.
And Dr. Kargman, we're running down to about a minute left. Is there any other thing that you want to address real quick before we say goodbye to you?
Not really. I mean, I'm happy to, work with people or answer people's questions, going forward. If people want to, get in touch with me, they can call my office over at Maryland Natural Health Center. They can find me on my website, which is Maryland Natural Health Center, all spelled out.com. You can email me through there, call me through there. Like I mentioned, I'm happy to do 10-minute free consults with people, are interested in becoming patients.
Yeah, sure. What is your phone number? You can give it out here. It would be great. And an email address, too.
Yeah, the phone number is 410-356-4600. And again, email, just do it right through the website at marylandnaturalhealthcenter.com. And you can email me directly through there.
That's great. And you are accepting new patients, right?
Mm-hmm.
Do you do virtual appointments?
Yeah, right now I'm doing pretty much primarily virtual appointments.
Great. Okay.
Yeah, but, I guess the one thing I'd like to say is, that you don't have to live with digestive issues. If you're having problems and your doctor tells you, there's nothing they can do, then call me because there's a lot you can do.
Great. Thanks for giving hope to a lot of people here, Dr. Kargman, and appreciate you joining us today.